My name is Andrea Hutchison, and this is my presentation on evidence-based practice, specifically for transfusion procedures. Transfusion is the process of replacing blood or blood products intravenously into somebody to treat anemia. Examples of blood products would be either packed red blood cells, plasma, platelets, just a few. Organizations or nursing units that are going to be giving transfusions most frequently and would benefit the most from some evidence-based practice on them would be emergency departments, oncology units, trauma floors, and the American Red Cross. Patient populations that most often receive blood transfusions would be trauma patients, oncology patients, and GI bleed patients, which is a gastrointestinal bleed. Patient outcomes after getting a blood transfusion would be an increase in hemoglobin and hematocrit levels, and an improvement in vital signs. Their heart rate's typically going to lower if they were tachycardic. You're going to see an improvement in weakness and fatigue in the patient. Research, I found a couple different articles that were studying specifically blood transfusions that I found is called blood transfusion therapy. And basically, it was 19 different trials that involved 6,264 patients, and they were comparing giving a blood transfusion when a patient was on the high threshold of a hemoglobin level and on the lower threshold, and compared the results. I found that the outcomes were pretty similar. The transfusions given at the lower threshold did show reduced episodes of cardiac events, rebleeding, bacterial infections, and mortality. Future research on this topic could include giving the transfusion at the start when a patient's hemoglobin levels are on the higher threshold, just to see if they have a better outcome in the end. Grade quality scale to compare their results, and they found low to moderate differences in how long the blood cells were stored before they were given. The article that I found was called Transfusion of Red Blood Cells Stored for Shorter versus Longer Duration for All Conditions. The particular study was 22 different trials and involved 42,835 participants. The particular study was evaluating the effects of patients that received transfusions of red blood cells that were stored for a longer time before they were given to the patient. Research on this topic, I think, could involve studying different types of blood products as opposed to just the red blood cells to see if there is a difference. The article that I found was called Red Blood Cell Transfusion for People Undergoing Hip Fracture Surgery. The particular study involved 6 randomized controlled trials and involved 2,722 participants. The study was to assess the effects of red blood cell transfusions that were either given during people undergoing a hip surgery or people that did not receive a transfusion during surgery. It was only looking at patients with a hemoglobin level lower than 10. Also used the grade criteria scale and to assess the quality, low, moderate, or high, and they found that there was low evidence to determine that there was not strong enough evidence to start a transfusion when somebody's hemoglobin level was lower than 10 during the hip surgeries. Future research on this particular topic could include different types of surgeries as opposed to just the hip surgery. Based on current evidence, there's not enough sufficient relevant evidence to change the current best practice. Research did find that overall there were positive results for patient outcomes for those that did receive the blood transfusions. So the current recommended nursing interventions for blood transfusions, there are quite a few. Nurses are the ones administering the blood products, so they need to be well aware of the current best practice. The major things that they need to be aware of are the consents signed prior to giving the transfusion, as the signs need to be monitored very closely during a blood transfusion of any kind. So it may vary from hospital, like facility to facility. The patient is going to be monitored throughout the entire transfusion by the nurse for any signs and symptoms of any possible adverse reaction to the transfusion. And to have a double check with a second RN, and you need to verify that it's the correct patient, correct MRN number, correct unit number of the best practice. Kind of seems that there's not strong enough evidence currently to change our current practices. And the nurse administering the transfusion needs to be aware of their particular facility's current policies